I'm hoping you've been able to come up with some high-risk patient groups. So one of the main groups is the elderly. There's increased risk of GI toxicity using non-steroidal anti-inflammatories. There's increased risk of side effects with opioids, in particular drowsiness and confusion, and that can in turn lead on to falls, and also they have an increased risk of fractures, so any falls could result in a fracture. Children, so obviously under the age of 16 we can't use aspirin. Anyone with cardiovascular disease or renal disease, mainly because non-steroidal anti-inflammatories can impair renal blood flow, but also cause sodium and water retention, which can aggravate things like heart failure and high blood pressure. Patients with hepatic impairment will have increased risk of gastrointestinal bleeding with the non-steroidal anti-inflammatories and aspirin. And again, anyone with a history of gastric intestinal ulceration, you have to use non-steroidal anti-inflammatories in caution, and anyone with active ulceration, you can't use non-steroidal anti-inflammatories at all. And then of course we have those that are pregnant and breastfeeding. Generally we will be using paracetamol first line for them. So common conditions that you'll see people coming into your pharmacy with: activity and sports related injuries, bruising, lower back pain, arthritis, minor soft tissue injuries. Obviously we need some more information here, but generally those we can treat with over-the-counter products. But any severe or soft tissue damage, then we would be referring. Activity and sports related injuries can be divided into 4 categories. So we've got sprains, which is overstretching or twisting of ligaments. We've got strains, where there's muscle or tendon injury causing swelling and pain. And then there's bruising. So this is damage to the capillaries causing blood leakage. So blood leakage is where we've got small vessels in the tissue under the skin, and you get some blood leakage there, which obviously produces the bruise. And then breaks, so any bone breaks or fractures, obviously we would need to refer. So some of the sports related injuries, particularly on the foot, sprains. So inversion is where the injury is to the outside, and eversion is where the injury is to the inside. So this is a nice table summarising the different types of injuries that can occur. Achilles tendon is the tendon at the back of the lower leg. Runner's knee is where you can get softening of cartilage beneath the patella in the knee, and that can cause pain and swelling. Bursitis is inflammation of the fluid-filled sacs that cushion joints, so that can be quite painful. And there's also plantar fasciitis, which is inflammation of the condition of the heel, which again can be quite common in runners. The healing process for activity-related injuries occurs in 3 phases. Phase 1, you've got inflammation, which lasts about 72 hours. So this is where blood and tissue fluids accumulate, causing swelling, and they can also cause redness, heat, pain, and formation of blood clots. Now, at this stage, applying price can be quite useful, and if managed correctly, can minimise recovery time and also minimises swelling and secondary tissue damage, but we'll cover that a bit later on. Phase 2 is tissue repair, which can last up to 6 weeks, so this is a longer process. Blood clots are removed and tissue repairs and scar tissue can form. And here is when we can offer analgesia as a help if needed. Phase 3 is where the scar tissue changes into a more ordered arrangement. So the scar repair fibres arrange into a more ordered arrangement, which is promoted by gradual activity and gentle stretching and a gentle increase in movement. So what do we need to know? When these patients come into our pharmacies, we need to gather as much information as we can to help us decide what is the best course of action. So who is it for? Obviously whether it's an adult or child, because that can dictate on the preparations you can give. What are the symptoms? So what sort of pain is it? What is the severity of the pain? Is it a sprain? Is it a strain? How long have they had, or when was the injury? Are we talking days? Are we talking weeks? Have they tried anything yet? If they have, did it work? Are they on any medication? So are they on any medication for previous injuries and or other medical conditions? What else do we need to consider? So when was the onset of the injury and what is the duration? Has there been any improvement within 72 hours? Where is the injury? Confirm the type of injury and what was happening just before, what events were happening leading up to the injury. Are there any other older injuries that they may have? And with medication, we need to be aware that some medications can mask pain and might increase risk of fractures. The patient might already be on painkillers, in which case the pain may not feel as severe as it actually should do and may not feel as serious as the injury actually is. What can we do to help? So obviously we can give some analgesics. Paracetamol would be first line, and that could be used in combination with a topical non-steroidal anti-inflammatory, so something like ibuprofen gel. The patient may also want to take oral non-steroidal anti-inflammatories, but they shouldn't use both oral and topical agents together. It might be that they use a combination of products, so they use the tablets when they're out or at work and the gel when they're at home. This is the pain ladder, and we can choose our pain control or our analgesics in relation to the pain score. So you can ask the patient what they feel their pain score is. And this is on a 0 to 10 basis, 10 being the worst pain you could ever imagine. Although, as we discussed earlier, this is quite subjective because everyone perceives pain differently. So at the bottom of the ladder, we'll start off with something like paracetamol with or without or non-steroidal. We'll move up towards mild opioids, and then from there up to strong opioids. Obviously, we can sell non-opioids and mild opioids over the counter, but anything stronger than that will need referral to the GP for a prescription. What non-pharmacological advice can we give? So we can give advice using price and harm, which we'll go through in a while. And obviously, if the injury is a frequent injury related to some kind of sport, some advice on how this can be prevented in the future. Most minor soft tissue injuries can be managed at home using the Price procedure. This relieves pain, reduces swelling and speeds up healing if it started as soon as possible after the injury and continued for 48 hours. So we need to protect the injury against any further damage and rest it for the first 2 to 3 days. We can apply ice to the skin, obviously not directly to the skin. We can use something like a bag of peas, and this needs to be done for 20 minutes, 4 to 8 times a day. Freeze sprays can also be useful here. Compress, apply an even pressure bandage to the injury, not too tight, just enough so it's comfortable. Although this does need to be used in caution in peripheral artery disease and the elderly and in diabetes. And then finally, elevate. So elevate the injury helps to reduce the swelling. Harm is all about avoiding those things that can make things worse in the first 2 to 3 days after your injury. So heat can increase blood flow to the area, so things like hot baths and things can make it worse, and increase in the blood flow can actually increase the swelling. Alcohol should be stopped, if not reduced, because it can increase the risk of bleeding and swelling. Same with extreme exercise, can aggravate the injury and make things worse, as well as massage. Some customers might ask about rubifacients. So there are topical agents that cause dilation of capillaries and increase blood circulation to the area, although there's little evidence to support them in acute injuries. They should be avoided on use around the eyes, on mucous membranes, and also on broken skin. There's many different ingredients in them. So nicotinates, you need to be wary because it can cause hypotension. It causes vasodilation and therefore can make people feel a bit dizzy and faint. Menthol has a soothing, cooling sensation, which can be followed by warmth. Camphor can be highly toxic, especially if swallowed, and capsaicin is actually made from peppers. It does not cause a reddening, but it can cause like a warm feeling. So these are our red flags, or any symptoms, if present, that we need to refer to the GP. So any severe or prolonged pain or swelling, if the patient's unable to bear weight, if you can visibly see any bone or joint out of place, if it's an old injury that is recurring and keeps coming back and there's aching and swelling, any signs of infection, so that could be the patient could have a fever or it might be warm to touch, any head injuries, pins and needles or numbness, and also obviously if they've tried some treatment and there's been no improvement within 5 days. So should we be recommending there's any movement of the joint? That will depend on whether it's a sprain or strain. So with a sprain, yes, we should be recommending mobility. Flexibility exercises should be started as soon as possible, obviously without causing any excessive pain. There might be bruising, pain around the joint and swelling, which might cause it difficult to move the joint to its full range of motion. For strains, we need to immobilise for the first few days. There might be some muscle spasms and pain around the joint. Presence of bruising is due to leakage of blood into the tissue from the local capillaries. If there is presence of bruising without an injury, this could be due to a more serious condition such as an underlying blood disorder. So any bruising without any injury should be referred immediately. What do we need to know? So who is it for? Obviously, again, that dictates what sort of products we can recommend. Also be aware, say if it's a child coming in with frequent injuries, could it be a child protection injury issue? What are the symptoms? So is there any bleeding? Was there any trauma? Is there anything that is there bruising without any explanation or injury? How long have they had it? So is it just something they've had for a few days, or is it more long term, or for a few weeks or more? Have they tried anything and has it worked? And are they on any medical any medication, or do they have any medical conditions? So things like warfarin, that's a potent blood thinner, and that can increase the risk of bleeding. So any patients on those medications would need to be referred to the GP. What can we do to help bruising? So there are heparinoid products that are absorbed into the skin and they help dissolve blood clots. They reduce inflammation and pain, reduce the discomfort and improve the circulation of blood through the superficial veins, which can help with healing. Witch hazel is a product that causes contraction of the skin cells and body tissues, although it should not be used, obviously, on broken skin. So when do we need to refer? If there's anything unexplained, for example, if they've got pain with no apparent injury, whether it's a frequent thing or if it's very excessive. The liver is responsible for making clotting factors. So if there is a history of hepatic impairment, then obviously there's increased risk of bleeding. So those sort of patients would need to be referred. As with those with any clotting problems, there's going to be increased risk of bleeding. Anyone taking medications such as warfarin, non-steroidal anti-inflammatories, steroids or carbimazole also would need to be referred. Lower back pain is another common thing that you will see coming into the pharmacy, and there's lots of different causes. Obviously some will be more common and some less likely, so those less likely ones would need referral. It can be acute. Generally, with regards to back pain, we say acute is less than 6 weeks, subacute between 6 and 12 weeks, or it could be chronic, which is more than 12 weeks. What do we need to find out? We need to find out who is it for, adult, child, elderly, because obviously that will dictate what medication we can recommend for them. What is the type of pain? Is it a shooting pain? Is it an aching? Is it a dull pain? Is it quite a vague pain? Is it any temperature? Is there any things like stinging when urinating or cloudy urine? Because often a back pain could be a sign of a urine infection. How long have they had it? Has this just been a thing with days? Is it weeks? Or does it coincide with a menstrual period? Because then it will be a different type of pain, period pain. Have they tried anything? And if they had, did it work? Or has the treatment failed? Do they have any other medical history and any medical conditions? And are they taking any medication? So a full history needs to be taken for you to be able to advise appropriately for the condition. Now just take a few moments to consider if somebody comes into your pharmacy with lower back pain, what sort of other things that you might want to ask to help decide how to manage the problem, and then we'll go through it in the next screencast.